Hello, Dr. Vadiraj. This is Dr. Satyam here. We welcome you for this report presentation session of the entire conference. What did we do? How did we do? We did all this in collaboration and full support of Central Council of Research in Yoga and Naturopathy with the questionnaires shared by Dr. Rao. So to all the viewers, let me tell you something about our Dr. Vadiraj, who is here for report presentation. So Dr. Vadiraj is one of the senior most officer in Central Council of Research in Yoga and Naturopathy as assistant director. Following to that, he is a PhD holder with leading researcher in yoga and health, which we call it as yoga and life sciences. He was my supermost senior. When I did my MD, he completed his PhD that year. Following to that, he was continuously working for a lot of research standards and fixing research protocols in the scientific committees locally in Karnataka, following to that in New Delhi. He has eminent experience of yoga related to cancer as well as other modalities. So we welcome Dr. Vadiraj here. So Dr. Vadiraj, we have 4 presenters here. One, Mika from Japan. Second, Barbara, she belongs to Germany. One, Sandra, she's from Switzerland. And one more presenter, which is Kiran, who is basically from India, but now a Singaporean. So all 4 of them have their own part, which they are going to present what has been done in this, in the preparation of the conference. Along with that, any feedbacks, whatever is needed to be corrected and things have to be done, we will be needing from you. So Mei-Ling, let's start the introductory video first. Following to that, the presentation will start.
Yeah, just I would like to say that thanks for introducing me to this session, and we're eager to hear the presentation. Thank you.
It is a pleasure to warmly welcome everyone to the first International Conference in Integrative Medicine by Union Yoga Ayurveda Singapore. This conference offers a great platform to assemble an international conference and community of modern medicine, integrative medicine, and holistic scientists to come together to find out what best can we do for the cure and management of cancer. This is an important cornerstone in action. For that, we have welcomed the best physicians of the world for modern medicine, the best physicians of the world from naturopathy medicine, the best physicians of the world from Ayurveda medicine, and physicians and masters from yoga under one roof. We have planned this conference in 3 levels. In the first level, we work with patients who already used yoga protocol shared and planned by Union, and who are already taking modern medicine or treatment from conventional hospitals, and we gave them the intervention to check the immediate effect, and the feedback was collected. In the second level, we welcome different scientists from all over the world in form of the abstracts to compile into a souvenir booklet. In the third level, we are going to bring this panel of doctors and masters together to discuss and pave the way for what should be done next to make it as an international standard medicine and education, where we also welcome the international standard centers from IIYT and Maryland University of Integrative Health. The aim of this conference is to bring awareness on integrative medicine and holistic practice and how is it influencing combating cancer and its side effects. The objectives of Union Yoga Ayurveda is to develop research protocol for complementary therapy for cancer with yoga and Ayurveda therapy. And another objective is to introduce a research protocol and proposal to the Ministry of Health of Singapore of Ayurveda, yoga therapy and integrative medicine. Next one is to show and develop a bond between cancer patients and yoga teacher, which can help to add life into years instead of only adding years into life. Furthermore, to overcome population from the myth of yoga as just a fitness regime and Ayurveda as just a oil massage to a scientific, validated therapeutic science. Last but not least, to teach yoga and healthcare professionals about proper data development and arrangement so that science can grow in a systematic way. Integrative medicine and holistic practice promotes the physical, emotional, and spiritual health of a person. It is often used to address a long-term alleviation of the symptoms. The diagnosis of cancer leads to severe changes in every part of life. Cancer patients often report a variety of problems during and after treatment. There are psychological side effects like stress, anxiety, depression, physiological side effects like hair loss, pain, vomiting, social side effects like social isolation, role and function loss, which all worsen the quality of life. In cancer treatment, patients are often required to make trade-offs between quality of life and length of life. Making appropriate decision requires understanding of these treatment choices, which include modern and integrative medicine, as well as holistic practice. In addition, quality of life has been increasingly recognized as an important endpoint. The results of this research shows how quality of life of cancer patients can be improved. Let's learn and grow together for a better and healthier tomorrow. Now I'm passing over to Sandra.
Okay, Mika and I are going to talk about methodology which was fulfilled by design, source of patients, intervention, and assessment. The next slide, please. No, yeah. Design was based on a pre- and post single-arm study plus convenient sampling. Measurement on the effect of yoga in cancer clients has been taken before and after interventional yoga sessions to recognize immediate response in participants. It is established on a single-arm study in which yoga practices have been given. Convenient sampling method allowed us to collect data quickly, process them by capturing and analyzing them. With this design, all cancer clients were permitted to participate, and this study was done on various types of cancer like throat, breast, lung, bone, leukemia, pancreatic, and more. I'm passing over to Mika, which goes further into the source of patients and intervention.
Move on to the next slide, please. Yes, now I'm going to talk about methodology, the source of patient. So we reached out to total 60 cancer patients from all over the world. So this slide shows about how we reach out to the patient. So in order to reach out to the patient, the participant, so our marketing team worked very hard on social media marketing. And also that Dr. Satyam and our union students worked on referral basis. Like we informed the patient, the union patient, and family members and friends about this awareness program. So as you can see, the green part, the 70%, the most trustful source is referral. But it is also true that the social media marketing helped participants to understand more about this awareness program. Okay, moving to next slide. So these are the posters very nicely done by our union students. So these are just samples, but we have many more, and they are made in different languages and posted on our social media, such as Facebook or Instagram, for marketing purposes every day. Okay, so next slide. And this slide is about patient, sorry, maybe one more earlier. We have one more. Yes. So this slide is about patient nationality. So we reached out to 60 patients, and with all the efforts, 41 cancer patients out of 60 had yoga sessions. So COVID-19 really affected the number of sessions because some of the patients are really hesitant to meet with teachers like in person or not familiar with online classes. So from the graph, 52%, which is majority of the cancer patients are Singaporean, but rest of 48% are with variety of nationalities. Like they are German, Indian, Russian, or Dutch, or the Swiss. Okay, the next slide is talking about the patient condition. So we categorize patients into two groups according to their condition. So whether in recovery stage, in remission, or having a chemoradiotherapy. So 67% of the participants were in recovery stage. However, we have to be aware that every cancer patient are in like a different condition, like a different level of energy, the different level of body flexibility, or different level of stress. Okay, and next slide is talking about type of cancer. So again, as you can see from the graph, the blue part, the 51% of the patients had their breast cancer. Almost a half of the patients has a breast cancer. And the others are very variety, like bone cancer, cervical cancer, uterus cancer, ovary, like endometrial, leukemia, lung, thyroid cancer, or pancreatic cancers. Okay, next slide. Okay, and then I would like to talk about protocols. So which protocols are used at the yoga sessions? So 3 protocols are prepared for the sessions, and teachers decide which protocol to use depend on patient condition or patient request. So I am going to talk about the details of protocols later at the later slide. So now I'm talking about which protocols are used for each sessions. So as a result, each protocol was almost equally used, conducted. Like earlier slides, I mentioned 67% patients were in recovery stage. That means they are assumed to practice protocol with cyclic meditation. However, that protocol, the protocol with cyclic meditation was practiced only 29%. That means every patient is different level of the condition or energy level. And at that level, that condition changes day to day. So even though 67% of patients are in remission, is in recovery stage, some of them prefer to choose the protocol with MSRT, or they choose a protocol without meditation. Okay, and then next slide. So now I'm going to talk about intervention. So this slide is about yoga teachers' nationalities. So we have trained 40 yoga teachers for this awareness program. And out of 40, 18 yoga teachers had sessions with cancer patients. So again, this slide shows about teachers' nationality. That the majority is Singaporean, 60%, but the others are also with variety of nationalities. We have Indian, Russia, Netherlands, Filipino, Swiss, Polish, Malaysian, UK, German, Japanese, and then those teachers are, they conducted the session in their language, different languages, and that definitely helped the patient feel more relaxed. Okay. Okay, this slide is about how many sessions were conducted, were needed for the teacher training for these cancer patients. So total 118 sessions, 195 hours are conducted. So due to COVID-19, we are planning to have all the sessions on site, but due to the COVID-19, the teacher training sessions were required to be online. So 59% is on site, and the other 41% were conducted online. Okay, next slide. So now I'd like to introduce about the protocols. So three protocols were prepared for this program. So protocols have to be standardized because they're easy to follow, easy to teach, and can get the almost same quality of effect. So these protocols are well research basis. So I'm just introduce the details about each protocols. The first protocol is designed for those who are not comfortable with meditation or making like om sound. So this protocol is started with breathing exercise, like bringing in oxygen to the body to relax the mind, calm the mind, and also make and flow more prana circulate to the body. And then Shushkuma Vyayama is to bring the awareness to each part of the body and gently stimulate the lymph nodes. And then Yoga Asana to strengthen the body. And then practice pranayama at the end. So this is the first protocol. The second protocol is designed for those who are in remission, who are recovering stage. So they are assumed to have certain level of strength, of power or energy. So they do the cyclic meditation after Shushkuma Vyayama. And the last protocol, the third one, is designed for those are still having chemotherapy or radiotherapy. So in this protocol, they practice MSRT, like a mind sound resonance technique, like a meditation practice instead of cyclic meditation to overcome the fear, to have more relax, to seek in more relaxation. So these are the protocols that all yoga teachers have to learn and remember, clearly remember, and teachers decide so which protocol is for appropriate to follow when they meet their participants, the yoga teachers. And next, please, I hand it over to Sandra.
Okay, I introduced the assessment. 3 various assessment forms were used in this pre- and post-interventional study design to capture and analyze feedback data from cancer clients. These documents, based on self-assessment, were chosen because of its easy use for yoga teachers, but also for cancer clients in filling out necessitated information, plus equally important on its evidential value. Following, I'm going to explain what kind of forms has been used. On the slide, you can see the pain detect form. This pain questionnaire was invented by Rainer Freinhagen and developed in 2004 in cooperation with German research network on neuropathic pain. This form turned out to be a successful tool in detecting neuropathic pain, plus helping in managing and improvement of the condition in patients. Translated into multiple languages, it is widely used for any kind of research which can be seen on proven abstracts and articles in ResearchGate and Google Scholar. The assessment form consists of 7 questions that address the character of neuropathic pain. They ask about gradation of pain, pain course pattern, and radiation of pain. Next slide, please. Another form we have used is the Perceived Stress Scale Questionnaire, which is a classic stress assessment instrument. The tool, developed in 1983, remains a popular choice for helping to understand how different situations affect our feeling and our perceived stress. The questions ask about feelings and thoughts during the last 4 weeks. It consists of 10 questions in which answers are chosen from the alternatives 0, which means never, up to 4, very often. The next slide. The one who has attended or listened to Dr. Meenakshi, please forgive me if the pronunciation is not correct, the name, she has talked or mentioned about the next form, which I'm going to talk about. This is the European Organization for Research and Treatment of Cancer Quality of Life Questionnaire Core 15 Palliative version 1. The European Organization for Research and Treatment of Cancer invented the Quality of Life Questionnaire Core 15, which is a shortened version of the Core 30 to make it easier for patients. The form includes new 15 questions compared to the Core 30, which consists of 30 questions in total. Both forms are the most widely used instrument in evaluating symptoms and quality of life in cancer patients and palliative treatment. The assessment form asks about quality of life experience, originally the past week, but in our study before and after the yoga session. Interventional outcome and benefit in patients was the recognition of the immediate effect of yoga in cancer through pre and post implementation. Clients achieved the benefit of a new experience on the effect of yoga, free and private yoga session. The next slide. Teachers' outcome was increasing proficiency from teachings in how yoga can be applied specifically on cancer clients, which is going further into yoga therapy. Benefited have the teachers with immediate implementation of the gained knowledge. Additionally, they supported statistical analysis in filling out assessment forms with clients, plus transferring them to the responsible team. Next slide. Submission of abstracts was also part of our studies to bring awareness on the effect of yoga, but also Ayurveda in cancer and other diseases. After the conference, the abstracts may be proceeded and published in future. 78 abstracts were submitted in total, and examples will be combined in the souvenir booklet. The next slide. So also we got hit from the COVID-19, and it brought some changes and challenges in our study. First, all conducting classes and yoga sessions had to be changed to online. Secondly, teaching happened how to perform online yoga sessions for participants, as not all were used to this technical change. Third, questionnaire forms had to be new filled out via device. Fourth, another challenge which yoga teachers have faced was that nonverbal communication in clients could not be observed in the same way as in online sessions, which is actually very important in yoga therapy or Ayurveda treatment. Fifth, some clients preferred offline sessions and stopped to participate. Sixth, congress venue had to be changed to Zoom, and research outcome plus result had to be done with a smaller amount of or number of clients. If it comes to articles and abstracts, they could still be submitted, as this was not limited to cancer only. As we started with conducting yoga sessions online, we also began to extend the outreach of cancer clients from Singapore to worldwide. Now I'm passing over to Kiran.
We will now look into the results. First, we will look into the results of pain detect questionnaire form. The mean value, that is the average of data from the forms collected which were answered completely, is as shown. This shows the screening result before the first session of the selected protocol versus screening result after the second session of the selected protocol. Values 0 to 12 shows a neuropathic pain component is unlikely in these cancer clients, as per the scoring pattern of the pain detect form questionnaire. The graph shows a decrease in percentage change, that is 17.61%. Next slide, please. Here, we will see the results of the perceived stress scale form. Perceived stress is the feeling or thoughts that an individual has about how much stress they are under at a given point in time or over a given period. We found that the data shows the majority of the participants had a moderate level of perceived stress before first session and after second session. The scores ranging from 14 to 26 be considered as moderate stress level as per PSS. There has been reduction in the number within this moderate range. The graph shows a decrease in percentage change, that is of 1.05%. Moving on to the next slide. The perceived stress scale forms with the low, moderate, and high scores of perceived stress were categorized. Percentage of participants under each category can be seen in the graph. This graph here shows in green bar the pre-data, that is forms filled by the participants before their first yoga session, and the next color shows the forms filled by the participants after the second session. Majority of the participants had a moderate level of perceived stress, also shows majorly positive effect of the protocols after the second session. Moving on to the next slide. We are now looking at the results of EORTC C15 form. C15 form helps us detect various parameters which will help assess the progress of the patients, healthcare workers, and the doctors. If I may put it again, C15 form helps us detect various parameters which will help assess the progress for the patients, healthcare workers, and the doctors. We applied the data obtained using C15 form, used SAS program to calculate the result, and also calculated the mean of pre and post data to show the changes in the value of all the parameters overall. In the next slide, we see the values of each and every parameter. Here we see that pain, dyspnea, insomnia, appetite loss, constipation, fatigue, and nausea. All of these show a decrease, whereas parameters on quality of life, physical functioning, and emotional functioning shows an increase. All these readings shows an overall positive effect. Feedbacks from cancer participants have been positive in terms of their experience and ease of adapting the protocol in their daily routine. Over to Mika.
Okay, so conclusions. So as a conclusion, I would like to highlight the 3 achievements. The first achievement is that we could bring the awareness and happiness to everybody who was involved in this international conference. So of course, patients and teachers were happy with the results from the yoga sessions. And the yoga teacher might be happy that they could expand their knowledge. And all the guest speakers, organizers, volunteers, students and the delegates, they are very happily worked as volunteers to make this happen successfully. The second achievement, we had all the resources as a voluntary basis. So every attendees and patients, teachers, volunteers are all from the world, and a huge number of people are involved as a volunteers. And the third, the last achievement is that we standardized the protocol. So again, the protocols has to be standardized because it's easy to follow, easy to teach, and easy to practice by the patients. And it brings the same quality of effect. Okay, the next slide. So this is a word map. Visually, we can show that how this conference was held internationally. The blue circle, the blue dot, is for volunteers, and the green circle is yoga teachers, and the yellow is the guest speakers, and the orange circle is cancer patients. Again, we can see all the participants from all the world. Okay, next slide.
An idea is just like a seed. In order for the seed to grow, it needs constant nourishment, water, and sun. But in order for it to blossom and bear fruit, much patience is needed. The journey from seedling to harvesting comes with many challenges, from picking the right location, the right nutrition, and proper guidance. In the same way, getting this conference off the ground was not easy. The original intention was for a physical conference. A lot of hard work was put into finding an ideal venue and then planning the layout, building the necessary infrastructure, and working through the logistic of the day-to-day schedule. Just when we thought all pieces were coming together smoothly, COVID-19 hit, and it felt everything tumbled overnight, just like a house of cards. But what seemed like wasted effort was in fact the glue that bound us all together. Over the past few months, Dr. Satyam's unwavering vision for the conference guided the team, and as we adapted the circumstances and channeled our energy to bringing this conference to life as an online event, that all of you are now participating in right now. Thank you, and first and foremost, we would like to extend our gratitude to the Director of the Central Council for Research and Yoga and Naturopathy, CCRYN, Dr. Raghavendra Rao, for installing the idea of this conference in Union Yoga Ayurveda Singapore and supporting us from the very beginning. Heartfelt thanks also all to our speakers, panelists, and dignitaries. Dr. Raghavendra Rao, Professor K.S. Dhiman, Dr. Karen M Mustian, Dr. Sabbir Khalsa, Dr. Lorenzo Cohen, Dr. Veer Ramakrishna, Dr. Balendu Prakash, Dr. Santosh K. Rao, Dr. Akshay Anand, Mr. John Kepner, Ms. Diane Finlayson, Dr. Ahalya Sharma, Dr. Shivanshini Jaideep, Dr. Shreyas,
Thank you very much, Barbara, for doing this presentation. We have our Dr. Vadiraj and Dr. Akshay Anand here. So can stop the slides so that we can ask Dr. Akshay Anand sir and Dr. Vadiraj to give their feedbacks. So whatever we have done, because when our higher officers, higher authorities, when they say something we have done good, then only it can be good. So Dr. Vadiraj and Dr. Akshay Anand sir. Yes.
Just the congratulations for holding this meeting and using to the maximum the opportunity imposed by lockdown or COVID calamity that everybody has come together to deliberate on the value of yoga Ayurveda, especially because COVID is untreatable. And you managed it very well. You assembled the best brains in the world together in Singapore. And even though we cannot meet you in Singapore, we can at least meet you through online. And even though it's a Sunday, a lot of people can just join in, pitch in. It was a good panel discussion in the morning. Dr. Vadiraj was there along with Dr. Raghavendra Rao, Dr. Sabbir, John Kepner, and Karen and other people. So you had assembled them all. And we had 50-60 on the panel. That is what I could attend. The other sessions, unfortunately, I had my own prior commitments which could not be attended. But this is a good educational exercise, and especially at a time when this is most needed by people of Singapore and that area of Southeast Asia. And I think this is a time also to plan the road ahead. So what you want to do ahead is, one thing is to make it an annual feature. Perhaps you can look at that. And the second is to continue with the good progress we are making and putting things together in the form of a journal, which is Integrative Medicine Case Report. So we encourage people here as the editor-in-chief of this journal to please come forward and put these abstracts into at least 2 or 3 pages of case reports. So if you can do that, you will be able to publish this as an evidence, because most of what came out from panel discussion was that we should not claim big things unless it's a huge trial. And then I reasoned that what do people do if they have single case reports of benefits from yoga implementation, either in reduction of stress or less pain or some biological markers. So whatever those changes that need to be done at a bigger level. But if that is not possible, there has to be a venue where we can publish case reports. We have a venue here. It's called the Integrative Medicine Case Reports. You can publish it here. It's a journal that is connected with this conference also. So those are my brief few preliminary comments. Thank you for the opportunity.
Dr. Akshay Anand sir is editor-in-chief for a very prominent and very new concept journal called as Journal of Integrative Medicine Case Reports. No one was able to think to that level that what happens to that single case reports which have been successful and but has somehow they don't reach to people with their results. So he has been always a pioneer, and his pioneerism starts here again with a new journal. So all of you, please try to write reports and have to submit it to that journal. Let's see how much success we get in order to get published there, because it is not just publication, it has to go with peer reviews, and based on that, finally, if everything is properly documented and scientifically proven, then only things can be published there. So here we have Dr. Akshay Anand sir. So we have Dr. Vadiraj sir also. Any comments of what we are doing? Dr. Vadiraj sir? I think you have to unmute your...
Yeah, sorry. First of all, I would like to congratulate the entire team headed by yourself in organizing this conference. If it is offline conference, it's a different story, and it is an online conference. So many challenges you had to face, and you have overcome all those things. And ultimately, it was a successful conference. Congratulations. And with respect to the presentations, the case presentations, what they have presented, only one suggestion is that I think they have used perceived stress scale as one of the questionnaire. Right. Actually, the perceived stress scale is supposed to use to measure a 1 month intervention evaluation. So it's not for immediate effect evaluation.
Okay, sir.
Okay. And I don't think about this pain detection questionnaire, whether it is a reliable and valid questionnaire, because these things we have to take care before starting the research, whether the questionnaire is a valid and whether it has a reliability. And so then only we can use all these things. Anyway, they have done a good work. That's why they could not find any much change in the perceived stress scale. If you look at only, they found only 1.05% change in the perceived stress scale. Could be because it is not the measure to assess immediate effect.
Okay, sir.
And in the yoga protocol, they have said some patients were not willing to undergo meditation or Om chanting presentations.
Yes.
Means in that case, instead of meditation, they can include a relaxation techniques like quick relaxation technique, instant relaxation techniques. So these are the shorter version of relaxation practices, which provides similar effect that of meditation. So that can be incorporated in that. And other things like they've used both active as well as remission cases. So it's better to select each one separately so that they will have different effects. So apart from that, anyway, they have done a good work, and congratulations to the entire team, and congratulations to your entire team, and hope to get better in the next year.
Okay, sir.
So thank you very much.
In your presence, we are going to launch our souvenir. Thank you very much, sir. We wanted to have this opportunity to launch our souvenir in front of our two scientific authorities. One is Dr. Akshay Anand and Dr. Vadiraj. Our students are happy. And so if there are no questions, then we can have a leave here. So thank you very much, sir. Thank you very much.
Thank you. Congratulations.
Thank you. Thank you very much, Satyam. Thank you.